What is genicular artery embolization and when is it needed?
Beyond 50 years, a lot of the patients, be it both men or women, they will suffer from knee pain. Medically, we call it as osteoarthritis because that happens due to progressive degeneration of the joint. We call it a joint synovium, as well as the other parts that constitutes the joint. As the time passes, these areas, the cartilage, they rub against each other. There's a lot of wear and tear, and that leads to degeneration, gradual thinning of this cartilage, and even bone surfaces coming together and causing knee pain. It is not just a physical abutment of the bones against each other. Rather, there is a lot of inflammatory process that is also going on. It is a minimally invasive treatment option, and basically what we do is we just go into the arteries of the knee and we inject some medicine into these small vessels, and we knock off the inflammation. So once this inflammation is gone, gradually the pain also goes down, and a lot of inflammatory markers that are generally produced by these the inflamed synovium or the cartilage lining of the joint now actually is suppressed. This is a amazing treatment option, a minimally invasive non-surgical treatment option for patients who are who don't want to go for surgery for the knee replacement, or who are too sick to undergo a surgery for knee replacement, and you have also failed the conservative therapy like painkillers and joint injections.
Why is genicular artery embolization better than conventional modalities of management?
Genicular artery embolization is a treatment option for those patients in whom surgery is not possible or who don't want to go for a surgery. It offers a long-term durable benefit. If you talk about painkillers, medicines, you will have to take these medicines almost every day and even twice or thrice in a day, causing long-term complications. Whereas joint injections, again with their own risks, doesn't offer a long-term solution to these patients, and even after a few weeks or months, even they stop working. Genicular artery embolization is a minimally invasive, totally safe procedure. There are no, I would say, serious side effects that have been noted or seen with this procedure, and not even a single minor side effect. I think the only minor side effect that has been seen, and that too in 4 to 5% of patients only, is a transient skin discoloration near the knee joint. That also goes away, I think, within a week or so. The biggest advantage is that now you're getting a treatment option without the toxicity of painkillers, without any invasiveness of putting a needle into the joint space. And this pain relief generally starts from a week or so, and actually now, as per data, also lasts for years. No cuts, no surgery, and you're able to walk home. You're able to go back to home on the same very day. We don't even require admissions for these patients.
What is your clinical experience on the results and present literature evidence of this procedure?
We achieved a good technical success and a clinical success in all our patients. And even as per literature, there's almost, as per technical success, is what we are, if you're able to do a procedure completely successfully. So that is almost up to 99 to 100% as per literature in our experience. Also, in terms of clinical benefit, almost 85 to 90% of the patients would have good pain relief. So in terms of pain relief, we have standardized scores like the WOMAC scores, and not just the WOMAC scores, we can even look for the visual analog pain scores. So as per all these pain scores, almost 85 to 90% of the patients will have a prolonged and a durable pain relief from after this procedure, lasting up to 2 to 3 years. And not just that, as I told you, because the inflammation is now controlled, so even the further worsening of osteoarthritis is probably slowed down to a certain extent, if not halted completely.
What is radial approach and how is it beneficial for the patient?
The radial approach has a biggest advantage that now we go through the radial artery, the one in our wrist, and we have modern advanced hardware, wires, catheters that are able to cross all the tortuosity, all the loops in the vessels, and we're able to reach all the places of the body safely from the radial artery. The biggest advantage is that the patient can walk back home immediately. The moment procedure is done, normally femoral arterial punctures have a problem of causing hematomas, especially in patients who have deranged coagulation, whereas that risk is totally minimized with the radial artery access.
What is your message to the general physicians about managing the patients in their OPD settings post this procedure?
Our side, our message to the general physicians would be that keep monitoring these patients regularly in terms of their pain scores and their other problems, because all these patients would have some other comorbidities. And in terms of pain relief, I think we can follow them up serially with their pain scores. Especially I would recommend using standardized scoring systems for osteoarthritis like WOMAC scores. And if not, we have a simple visual analog scale from 1 to 10 for the pain. So you can keep monitoring those patients